Massive thank you as always to our top tier patron Sarah Turner. For as little as $3 you can gain access to patron only episodes as well as access to our Discord server where we host weekly live discussions with host Ikoi Hero and myself. So if you like what you hear, come join us at patreon.com/it's not just in your head. Please do rate us on Apple Podcasts and follow us on social media. We're on Reddit, TikTok, Facebook, Twitter, and Instagram. And if you have any questions or comments about this episode or the podcast in general, then email it's not just in your head @gmail.com.
In the mental health field, too often, we've made it seem as if it's just in your head. Just in your head.
The landlord can hijack the rent by 20%. That impacts people's mental health.
We can't have a profit-driven mental health care system if we want our people to be connected and healthy.
Today, I'm going to ask psychiatrist in residency, Anna Zeira, about an article she had published in the Community Mental Health Journal called Mental Health Challenges Related to Neoliberal Capitalism in the United States. We have a link to the full article in the show notes for anyone wanting to read it, and I think you should because it's a really good article. So my first question for you, Anna, is what led you to want to write an article like this? Because when I think about psychiatrists, therapists, the mental health field in general, I don't tend to think that a term like neoliberalism fits well into how we think about mental health or psychology, psychiatry. So I mean, I think this way. Harriet thinks this way. I feel like there's a sort of maybe a minority of clinicians and everything. But what made you want to have this article published?
So it started in a lot of ways. I think it really started with my interest in social determinants of health, access to care, that kind of stuff. That was really the gateway. And it was with my service in AmeriCorps, I worked as a case manager and kind of noticed how difficult it was to coordinate care for homeless people living in poverty, and kind of really realized the social safety net affects people's health. And not having that social safety net really affects people's health and their ability to make appointments, pay for necessities and things like that. And then I went to medical school in Florida, and they haven't really even expanded Medicaid. So most of the people I saw who couldn't afford health insurance through the marketplace would have to pay for follow-up appointments. And we really saw some of the worst cases of advanced disease. Lots of comments about how you would never really see the infections you would see anywhere else in Florida due to the advanced AIDS and people not being able to get care. So really formative for me. And that led me to organizing with the DSA and their Medicare for All campaign. And because I was really seeing kind of the repercussions of what it looks like to be in a state that didn't expand Medicaid. And we all know how that's going. So then I started working in psychiatry. And so it kind of, I just had interests in psychiatry. And when working in psychiatry, especially in the Psych ED, we had a lot of homeless people coming in with suicidal ideations, some people to get a place to sleep, but also when some of them told me about what they've gone through, losing everything, feeling alone, and kind of working in this survival mode, it wasn't really a stretch for me to imagine why they'd be suicidal. And I felt really helpless in this situation. Like, how is an SSRI going to fix that? That's just kind of like, I don't know how that would fix anything. So I think it all came together after reading Johann Hari's book, Lost Connections. I heard him speak on a Mad in America podcast in my 4th year of medical school. And that's where I got the overarching view of it. Because he talks about the 9 major causes of depression. If you haven't read the book, I think it's a really good book. But he said the 9 major causes were meaningful work, loss of meaningful work, loss of connections to other people, loss of meaningful values, childhood trauma, loss of status and respect, loss of connection to the natural world, loss of a hopeful and secure future, and genetics and brain changes. And I kind of realized that 7 out of 9 of those were due to capitalism. And I felt like the book didn't really make that connection. So I also started thinking a lot about my own life after reading that. And I think kind of the periods of depression that I personally went through were during periods where I was really focused on materialism, social climbing, and I realized I got so much happier when I stopped valuing those types of things. So I really made that personal connection with the book as well. And it left me thinking like, if like, would I have been depressed if the world was a different place? And I think that that's really kind of what got into my mind of the society, of like the way we do things, the values that we have, leading to depression because of really my own experience. So after reading Lost Connections, I started researching more about capitalism and mental illness, found Deaths of Despair and the Future of Capitalism. And that really focused things on neoliberal capitalism rather than capitalism as a whole, and how it kind of affected the social safety net, but also attitudes around individualism in the job market. That really led me to connect to a lot of the conversations that I've been having with my peers about having an insecure future, even with a college degree, and people not being able to find jobs, needing to go to grad school because the job market's just so terrible, and having that insecure future that kind of discussed in that book. So I guess it all just made sense. It all just came together and made sense. I didn't see many people talking about it, so I decided to put it together.
That sounds really relatable for me in a lot of ways. So you use this term neoliberalism, and in the title of your article, there's the term neoliberal or neoliberal capitalism. So what is neoliberalism?
So I think it boils down to like economically and socially to the Margaret Thatcher quote along the lines of "There's no such thing as a society, only individual men and women." So policy-wise, it's the prioritization of the market needs over government regulation. So policies that are considered neoliberal are policies that take power away from the government and give it to market forces. I think it also assumes that the market can provide more for people than the government. And so services that were once under government regulation were transferred to private companies. And since private companies are driven by profit, there's also that always the ulterior motive to make money. I think a lot of people assume that these are right-leaning policies from the Reagan administration, but there are also a lot of Democratic presidents who have been on board with this and enacted some really damaging policies. So it's really been a bipartisan effort, so to speak. I think it's, as far as neoliberalism goes, it's like socially, I think it's like this evaluative social order about like your market value is the merit that you have to bring to society. So the more profitable you are, I guess, the better you are in society. And so it kind of leaves us evaluating each other based on market value and kind of I guess it kind of also brings in this like competitive individualism and really being beneficial to society by producing and working and being profitable.
So it seems like neoliberalism is maybe like a sort of economic philosophy and economic set of maybe priorities and values, but then it seems like it's also a sort of almost like an ideology and like a culture in and of itself as well. Like it's all kind of one big, somewhat complicated package. And then like a different thing, I don't know if this rabbit hole is worth it for right now. I've heard some people say, look, well, why don't we just call it capitalism? Why, people call it neoliberal capitalism, financial capitalism, monopoly. I've heard all these terms and they're just like, let's just call it capitalism. That's kind of the problem. Actually, based on that, I'm curious if you, if there is a particular reason that you wanted the term or the focus in your piece to be on neoliberalism, if there's maybe a historical, it's like over the last 50 years in particular, or if it just felt more, I'm looking for the word, not modern, like more recent, like more relevant to now kind of thing. If maybe that was the reasoning, or.
Yeah, I think a lot of it had to do with data because, of course, like with medicine, it's very data driven. And I really wanted a data driven piece. And the data that I had was from the neoliberal era. So, I mean, okay. I did think a lot about like the Industrial Revolution into all of this, but wasn't really able to find data. So I think that that's why I focused on neoliberalism. It's because kind of where the sources led me and where we have the most data.
Okay. So what would you say is the relationship between neoliberal policies, which you cover in your article, over the last 50 years in the US, and mental illness, as well as just people's general sense of well-being?
So I think there's been huge increases in anxiety and depression, and those really coincide with the neoliberal policies. A lot of theories as to why it happened, but I think it has to do with neoliberalism. I think some of it's with the conditions that are created for people in the job market, like loss of union power, but also outsourcing labor overseas. And I think that people are starting to feel like work has no meaning. There's less control over how much time we're spending at work. And, the gig economy as well, creating these short-term meaningless jobs that don't have any sense of long-term security or benefits and no real opportunity to build a career. So I think that kind of people kind of getting into these short-term meaningless jobs has done a lot to, I guess, break down people's morale or make people feel like work, they're spending so much time at work and work's not even enjoyable. They don't even they're just kind of part of this, money-making machine, I guess. And I think the wage gaps created by neoliberal policies have done a lot to the American psyche. I mean, you have, of course, increases in poverty, which leads to increases in adverse childhood experiences, which is something that, we know is true. We know that anxiety and depression are more common with people living in poverty. But I also having these ultra rich people setting trends, living this very public, lavish lifestyle has caused, I think, some damage. We have to keep up with these people, but we can't. And it's kind of always trying to strive to keep up with the trends that are moving so fast. And I think that the wage gap makes us all have more class anxiety and needs to secure our place in the social hierarchy by keeping up with the trends. But, we're never really able to. But I think that's where policy fits in. But I think also with that comes the focus that is currently have on status, wealth, which I think partially has to do with this neoliberal social order, but also the wage gap, I think, really is the thing that is driving that.
Yeah. So it sounds like there's some concrete things where it's just there's more job loss from outsourcing. There's a lot of things that you can sort of materially point out, almost from some statistics and data. And then there's this side of it where it almost seems like it's more when you mention, is it not Johann Hari? That's the spirit level, right? I think the Lost Connections book.
Yeah.
Where it's interesting that, sorry, I'm just making a quick connection from what you said about that, in that the last piece you mentioned was genetics and brain and basically biology, and all the other things had to do with sort of purpose, meaning making, social connectivity and everything. So you're saying that the neoliberal policies seem to have with the wage gap or productivity wage gap and all these differences in the economy, that they actually made meaning making, human purpose seeking, and social connectivity harder to achieve, right? Which erodes the psyche. It can increase depression and anxiety, which is exacerbated by things like increased poverty and higher ACEs scores, which then, right? So you're describing this compounding after compounding set of factors, right? That just kind of is bad for mental health. Okay. Just want to make sure I understand.
Definitely. Yeah. I like that you came back to Johann Hari because it's the loss of meaningful work, loss of social connection, meaningful values, and and status and respect, connection to the natural world, and hopeful and secure future. I think that has to do with the policy of dead end jobs and the wage gap, which makes us focus more on materialistic values, which come from, referencing the Wilkinson and Pickett book, talking about how wage gaps in, there's higher rates of anxiety and depression in places that have more unequal distribution of income. And I guess their theory is that it has to do with class anxiety, and it has to do with feeling like there's an us versus them, or there's like this unattainable status that you can't really get to, but are continuously trying. And
well, it's like I need the Lamborghini, and I need the lifestyle of the person that has the Lamborghini. But like realistically, and it almost becomes, maybe delusional is a strong word. It's like a judgmental term often, but like it's never going to you're never going to get the Lamborghini, and you're never going to live that lifestyle. So it's just like this living in this sort of depressing fantasy, right? Where you're being bombarded with a value system that says that you have to have something that you can't have. And so you're sort of striving, I guess, but, especially if you're working a low wage job, it's like, there's no, if you've internalized that value system, but you look around you and you see there's no realistic way you could ever achieve that. You either have to like just sort of, feel really badly knowing that you can't align with your own value system, which you've inherited from the society around you, or you have to live in a bit of a fantasy, right? And maybe even I would think that there could be some, we've all met the people who are like, maybe like pretending like they're acting like they're rich or important or something like that. Right? We maybe might want to say quote unquote narcissistic traits. I don't know if it correlates with that, but because you believe that you should be. So if you pretend and you act like you are, people will actually respect you, and you'll actually have the relationships you want in life, right? Whereas everybody around you is like you're kind of full of crap, but like and you get a lot of people acting like that. So
and I think that also it's like, in a way, it's not their fault, because there's so much there's so much emphasis that's put on like status and wealth that it's no wonder that they feel like they're going to get respect if they're rich, or that they'll finally get people to like them and respect them, because that's how rich people are treated in our society. They're the people that everybody cares about, like everybody talks about. And so if you're feeling worthless and meaningless, it's like, or if you're feeling worthless, or kind of like nobody's paying attention to you, maybe that'll change if you get rich, because it worked for other people. It reminds me of actually a lot of like, bringing up Miami. I feel like it's got to be one of the worst places for this kind of stuff. We would, hear stories about people who have like a leased Lamborghini, but can't pay their car, they can't pay their mortgage, because they want the optics of having all this money, but really not being able to keep up.
That's really interesting. Okay, so you kind of laid out this. I'm convinced that all these policies had a very negative effect on people's well-being and mental health. So the next question for you is, because it seems like it's almost like there's been this increased pool of suffering people who need help. So how do you think neoliberal policies impacted mental health care over this period? People's ability to get help from mental health professionals.
So I think there was this perfect storm of deinstitutionalization of the state hospitals and divestment and community welfare programs and community health center. I don't know how many years later, but it seemed like it was they happened together. And I think the solution to deinstitutionalization was that the community would take care of people with severe mental illness, but then you get the gutting of the programs meant to help them. And I mean, I think that we're seeing the effects now. I also think the pharmaceutical industry really influenced mental health care and made it so focused on pharmaceuticals because it's more profitable than therapy. And I think if the healthcare system, I think the neoliberal policies kind of made the healthcare system into this, for-profit type of service. And I think if it wasn't profit-driven and more outcomes-driven, we wouldn't really be having this problem and reliance on pharmaceuticals as much. I think that the fact that our healthcare system is profit driven, it's private, I think that's really impacted mental health care, the way we do things, and kind of the way we treat.
There's a little trailhead there I want to go down, because I want to see if I got when you said outcomes driven. So you're saying, I guess I want to understand what that means. Do you think that if if care were more outcomes driven, there would be less like what prescribing of drugs, or there'd be more psychotherapy, or what? I was trying to figure out what you were implying with the lack of outcomes driven.
I guess it's like hard to do outcomes with therapy, unfortunately, but or there's not a lot of data, or not as much data as there is with pharmaceuticals, but that also has to do with the fact that a lot of the pharmaceutical trials were funded by drug companies, and nobody's trying to do those types of things. So I think that if it didn't have to do with profit, then
I see what you're saying. I see what you're saying.
Yeah.
If profit is the determinant, if we're saying like, oh, this is working well because it's really profitable, right? That's basically like the zeitgeist currently. Mm-hmm. You're saying if it were, well, let's look at what's working, not at what's profitable, we'd get different results.
I think we'd be doing
probably
differently.
Yeah.
Because I think they do things differently in countries where they don't have a profit-driven healthcare system. I mean, of course, medications are still used, but I think there's not as much of a reliance on them.
I have to say, this is super mind-blowing hearing this from a psychiatrist. I mean, I know you're a psychiatrist in residency, but I'm like down the street, you're going to be a full-blown psychiatrist. I think this is maybe a side question for you, but do you, if you're okay with it, there's a stereotype about psychiatrists often, right? That like initially, psychiatrists once were practitioners of psychotherapy, like ubiquitous, like all psychiatrists practice psychotherapy, and there was an element of medication prescription. And now there's it's not totally true. There's a stereotype that psychiatrists don't, they only prescribe, like you come in for 15 minutes, you get some drugs, you leave. And then that is what a psychiatrist is. That's what they're for. That's what they're known for. So you pointing this out, I'm curious if you have any like view on that, just as a sort of side note before we jump back to the other question.
Yeah. So I think meds have a place. And I think that there is if you're unable, if you're unable to do the work in therapy because you are acting on your emotions and your emotions are so strong, then meds definitely have a place. But it's not like that view that you have to be on them forever, I think. And it's like, I feel like it can be a short-term way to keep you, to allow you to process, different things and how you go about coping with life, kind of to keep you stable.
Sure.
But I think that that's, at least with anxiety and depression, of course, with things like mania and psychosis, it's a little bit different.
Sure,
but,
like more severe. Yeah.
Yeah. But I mean, I think that I always fear that I'm going to become one of those, 15-minute med prescribers. I really don't want to, because I don't think it solves the problem. And there are other ways to prescribe medications, and not do that and not be like that. But I think I would hate it if I became, if I ended up going down that road.
Well, and I know there's also like, there's the sort of integrative and there's, there are different sort of movements in the field to move toward, and they're towards something more, whether when you use the term integrative or holistic or whatever. Anyway, it's a little bit of a side tangent. I mean, I do want to know your thoughts on these things, but just because your article was so amazing, I want to keep asking you the questions about the article. So what you've laid out so far is sort of, okay, what is neoliberalism? Why does this term matter? What's the sort of high level, zoom out and how does the system work? How has it been detrimental to mental health and social well-being and human connection, purpose, meaning making? What happened to the mental health care system during this period? So I mean, it can feel very hopeless because what you've laid out is like, because it's such a large systemic problem, and we in the mental health field mostly work on the micro scale. I'd say maybe social workers sometimes tinker with the macro a bit more than, say, psychotherapists and psychiatrists. But is there anything mental health professionals can do about these bigger systemic problems you've described?
Yeah, it's tough to know where our place is, and I'm trying to figure that out myself. But I think, discussing the issue more and talking about the evidence base that goes along with it is a place to start. We're always so evidence driven in medicine. So I thought that, pointing to the evidence can hopefully, allow people to really grasp this. But I think we also should be focusing on rebuilding community. I think that that's something that we can do that's more tangible in our everyday work. Like, we've lost community in this country, partially due to individualism and work taking over our lives. And, I think that loneliness is a huge factor in anxiety and depression, and we should be paying more attention to it. And that data is really solid as far as loneliness, anxiety, and depression goes. So I think most of my efforts these days are trying to figure out, have been with learning about community mental health groups, peer organizations, and trying to refer people and trying to get people back into a community. And I think that's the more tangible thing that I've been doing. But it's hard to work broadly, especially, as a sole person. But I think in Capitalist Realism by Mark Fisher, he talks about mental illness and neoliberal capitalism as like a focal issue in reversing some of the policies, which I thought was interesting. He was saying that, like, this is the evidence that we have that these policies are doing damage, and we have evidence for it. This is what we should be focusing on. And I'm still trying to figure out how to do it, but
yeah. Like, we need more mental health professionals thinking about it, because we're sort of, I think, I don't want to say like we're revered, but often like if there's a school shooting, or if there's a lot of like social problems that like suddenly they're like, we need more therapists, we need more mental health services and stuff. And then I'm like, well, that's me. That's like my colleagues and stuff. So what is it that people think we're supposed to be doing? Like, that we're supposed to fix society or something? Because like the sense of grandiosity that might give some of us, like, oh, I'm fixing society, because I'm more from an organizer perspective. When you mentioned DSA, I have that kind of background too, like organizing and stuff, and like, to me, that's much more probably kind of what's going to do it than mental health professionals. But if we've been put in this position where we're told by everybody else we're supposed to like heal people and fix people and make them whole and everything, which is a bit of a tall order, it's like, if the systemic level of the problems are so big, is that still true? Can we even make a dent in that world? So yeah, I'm with you in trying to figure that out. I agree with the community building aspect. I was going to ask you a question about our professional associations. In part, I'm taking some classes to become a clinical supervisor right now, and one of the trainer in the video, in one of the segments, he just kind of went on a side rant about our professional associations, saying that, and I don't know about any associations you're familiar. I'm not familiar with, like, I think, well, there's APA, American Psychology Association, or psychologists, and I think there's APA with the term psychiatrist, right? So there's two APAs, I believe.
There's two APAs and then AMA. And,
okay, so there's a lot of those, but so I don't know about for those ones, but for like CAMPed and AMPed. So there's like the marriage family therapist ones, and then there's ones for social workers. I mean, there's probably at least like a dozen of these kinds of organizations. He went on a side rant about how, at least for the MFT ones, that they mostly and almost entirely steer away from advocacy. He didn't really get into why, but he thought it was very even keeled. He didn't sound polemical or radical or anything in saying it, but he was saying, the bad part of mental health professional associations not getting more involved in advocacy is that if we are actually more compassionate, and presumably if we're data driven, and if we're looking at the suffering of society, and that if we have some decent ideas of policies that maybe should be implemented to reduce that, and if we fail to use our associations for advocacy purposes, he was like, that means that all the other organizations that do advocacy are advocating instead of us. And I thought it was a really nice, like an even keeled way of saying it. Like the way I would say it is just like swearing a bunch or something, and like, why the F are we not doing this? So that was cool. But so given that, right, that we have probably tens, if not hundreds of thousands of individual mental health professionals who are members of these associations, which do have lobbying arms and can at least, at the very least, publish letters about things, or, you know, whether they actually want to do phone banking or something within their membership list and say, like, call your senator or whatever, if those are effective methods of getting things done. What kinds of policies do you think our professional associations should be pushing for to reverse the effects of neoliberalism?
I mean, I think that the universal health care, Medicare for all, is a no-brainer. I don't see why that's not really being advocated for. It's baffling that it's still being debated by the AMA, especially when we know that the healthcare system is failing. And so I think that that's like the start, and kind of starting with anything that even like levels the playing field and makes this wage gap, issues with the wage gap better when it comes, and like making it easier to live a comfortable life on a minimum wage, with a minimum wage. And I think that's really the first step. After that, bringing back regulations on business, like limitations on lobbying, addressing power dynamics between employees and employers and employees. But I think that would be more difficult to sell. I think that starting with kind of the more basic,
just like access to healthcare kind of thing, right?
Access to healthcare, access to the ability to like live a comfortable life with, with a minimum wage job. I think that's kind of the I don't know.
I think those are big starting points as well. I mean, because in my, like, the way my brain works, I'm like, well, I see the connections between, like, why can't, say, CAMFT in California also advocate for like the PRO Act? Because I'm like, well, I see the connection of like why it should be easier to unionize the workplace. But I could also see the board of CAMFT saying, like, guys, we're marriage family therapists. Like, this is, it's a stretch to explain it. But Medicare for all, on the other hand, it's like, well, everyone would get access to healthcare. I mean, my concern, I think, is so when you said AMA, that's interesting because it's the same thing with CAMP. There's a monthly newsletter, or maybe it's more than a month, but there's always like this, there's a one pager that is like, eyes on the legislation world. And there's a bunch of bills, and it's like either endorsed by CAMP or monitored by CAMP, essentially. So AB 1400 in California, which is single payer for California only, which is being pushed by NNU, the National Nurses United group, on the nurses union. I've found it to be really impressive that the nurses union, they're not doing it to advance the profession of nurses. They're doing it as a universal principles humanitarian advocacy project, right? Like, everyone should have healthcare. I mean, maybe that would benefit nurses in some economic way or something. Like, maybe there'd be, now we need more nurses or something, and now we're going to get better pay. I don't know, but I don't think that's the motivation behind it. What I've seen from CAMP in California is that the languaging is like, there isn't much languaging about how it would benefit people. It's like, how will it affect the field? How will it affect MFTs? So the question from the CAMP perspective is like, if this were passed, would our reimbursement rates change? Like, there's no language on here, but I think this is what they're discussing. Would our reimbursement rates change from the state, for the state, government insurance? Would we get more clients? Would we get less clients? Instead of more broadly saying, like, would this be good for people? Right. Yeah. That's my concern with professional associations, for anyone listening that is in the field, that if I don't know if they agree, if it's like our professional associations seem a little bit too inwardly focused versus like, let's be a tool of improving humanity, because isn't that what our field is supposed to do?
Yeah.
Yeah,
so, absolutely.
Anyway, I know it's a rant, but that's my feeling on our associations right now.
I'm quite new in the association world. Starting out. I'm kind of seeing what the culture is like. It's definitely, I feel like, kind of more inward, less kind of globally or nationally focused as well. I think it's more like local. And I know that people are coming around to a lot of diversity, equity, and inclusion efforts, and kind of making the public statements and things like that. So I don't know.
I wonder if that'll be a stepping stone, because I could see it going either way. Like that, like the DEI stuff, I can see being, oh look, we did it. We did our thing. Like our mostly white organizations are no longer to be thought of as racist now because we said Black Lives Matter on a piece of paper, versus like, well, Medicare for all will disproportionately benefit XYZ people. So let's advocate for that. And let's like do a little campaign where we get our members to call certain target senators or something like that. Right. Like that would be, to me, that's like a more, if you want to use the language, like that's actually more anti-racist than saying we are committed to anti-racism, blah, 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 languaging, right? Sure. That like looks very sort of like the HR department wrote it for you or whatever to like not get sued kind of stuff, Anyway, there's my like 2 cents on that.
No, I hope it can be a stepping stone for sure. And yeah, I know. Yeah. I hope it can. I hope it can become something that creates a lot of change. So we'll see.
Yeah. Well, those are the sort of written questions I had for you. We went on a couple of rants, but is there anything else that you wanted to talk about or address or
No real thoughts that I have. Anything that you had in mind?
I mean, just I guess I want to say I really loved your article. It was really, really well written. It was really I was really surprised, as well as listeners might know, listening to this, I haven't been on the podcast for months because I like quit and I was like, I'm just going to do tenant organizing, and then I burnt out, and then I was like, I need to do like self-care stuff. I felt so like I was so impressed by your article that I was like, I want to see if the podcast gang will let me do like a one-off with somebody just to talk to the author of this piece, because this seemed like the core of a lot of what I've been wrestling with for many years now, having entered the field, like thinking about the world the way I do, and then entering the field and being like, oh my God. Yeah. And then seeing your piece, and I was like, oh, so this is it. This is the whole thing. This is everything. So I'm hoping that you get a little bit more exposure. Your ideas, your research, your piece gets more exposure in the field specifically. Yeah.
Yeah. I mean, I like, it's putting it out there. It almost felt like screaming into the void, because it's like, it's just kind of, it was, more cathartic than anything, and wasn't quite sure of what it would do, other than help me make sense of my thoughts as well.
Has there been any negative backlash? Did you have anybody just say like, this is too ideological, or like you're cherry picking data, or?
Not yet. No. Haven't gotten any haters yet. I'm happy about that.
Yeah. I mean, I guess like, would people like that be reading the community mental health journal, right? But yeah, I was wondering. I mean, one question I was thinking of asking you was like, how empirical do you think? Like, for example, when I was seeing the first, I think the like, what is the neoliberalism section? You quoted David Harvey so many times. But I was like, this is like a psychiatrist quoting David Harvey. I was like, this is nuts, right? Because like what, within like the mental health or the medical field, they just be like, who the hell is David Harvey? And they look at him and he's like this Marxian, economist or political theorist or whatever, And I mean, so for me, I'm like, that's so rad because that's so multidisciplinary. But I could see the naysayers being like, pointing the finger and saying, no, you need where's the data on the clinical trials for the drugs? Like that's the only thing we can cite. So
for sure.
That will be interesting if you do get some flack or something. But
actually, the editors of the Community Mental Health Journal were the ones who suggested Harvey. And some of this, so that was really, they were super helpful. They also, they gave me a lot of really good input, and led me to articles that I otherwise wouldn't have picked up. But so yeah, they were really helpful. There's a lot of like-minded people on that on the editorial board, which I was really happy about.
Yeah, that's great. Well, I guess last thing might just be, well, I was gonna say like tips for other, other mental health professionals in the field or something, but I guess more like how to cope with all this.
Oh man.
Um,
I think that's a hard one. I think kind of coping with it, at least for me, has been trying to get away from like materialism and status and competition as much as possible, because I know it makes me unhappy. And so trying to find people who feel the same way, who aren't talking about the new shoes or new handbags they got, and, really trying to focus on human connection and, trying to find your own community. And yeah, I mean, there's not much, it really, especially with like recent Supreme Court rulings, it's really felt, I've really been feeling the hopelessness, but I think some of that, learning from the studies and what makes human beings happy. I think focusing more on like social connections, and just trying to come together as much as possible, I guess.
Yeah. Okay, right on. Well, anyone who has listened this far, if you haven't checked already, Anna's piece is linked in the show notes, so you can read through it. Look at all the citations. There's a lot of citations. It is very data driven, and spread it around. If you are in the field, as the intention of the podcast initially was mainly to target the mental health field itself, as well as anyone else who wanted to listen, and like consumers of mental health services who wanted to just sort of thrust these ideas and these conversations into the field. So spread it around, share it with your therapist, share it with your psychiatrist, share it with your cohort members in school and everything, and say, oh wow, this is really, I never thought about this before, or something, so we can get these conversations going more. And I think that's all I really have for you. So
one of the things I also just thought of was with helping people cope with all of this is like talking more about the shame that comes with not being where you thought you were supposed to be, or not having a career that's going anywhere, or having these dead-end jobs, and kind of the shame that, like, what, at least with patients I've talked about it, that they feel like they're a failure or not good enough. And I think that realizing that there are broader systemic issues that you can't control, and if you don't have rich parents, then it's really hard out there. So not blaming yourself for where you are in life, or blaming yourself a little bit less. I think that that's another thing that I think I've brought into my therapy sessions with other people.
Yeah, that's great. I like that. Yeah, I've there's someone I'm thinking of right now who that's his main thing is, why don't I have a really big house and this thing and that thing, and still living with my mom, and and I've been like, dude, every millennial, the economy is trash. Everybody is in this situation. It's not you. Like, you need to talk to other people and realize, like, everyone. That is the thing. Sometimes I wish I could, like, I mean, I've thought about like trying to create groups with clients I have. I have not done this yet, but just being like, okay, you're all kind of talking about the same thing. I wish you could just talk to each other and not me, because like you'd realize, like, you're all kind of, the normalization of it, and then suddenly, maybe like a light bulb would go off, like, oh, we're all in this together, and let's like work together on, like you're saying, just maintaining those connections and maybe trying to change things.
Maybe feeling less shame about it. I feel like the shame's
it's like, it's not your fault. Yeah, and Harriet says that all the time. It's not your fault. There's this, it's the system. Richard Wolff always, it's the system. Okay, Anna, well, thank you so much.
Massive thank you as always to our VIP patrons, Alex Placito, Bruce Rogers Vaughan, Jennifer Cox, Justin Harper, Rebecca Johns, Seamus O'Connell, and Sheena Belmas.
If you have enjoyed anything you've heard Harriet say in this program, you will definitely enjoy Capitalism Hits Home, which is a solo program that Harriet does through Democracy at Work, which is a worker-owned cooperative that produces other great programs such as Economic Update with Richard Wolff and the Anti-Capitalist Chronicles with David Harvey. I can't recommend enough that everyone also listen to Capitalism Hits Home if you enjoy It's Not Just in Your Head.
And you can hear more from Harriet on her radio show called Interpersonal Update. It's on WBAI at 2:30 EST on Wednesday afternoons and in the WBAI archives.